Welcome, everyone. Grateful to have you all here for this Lunch and Learn Healing from Conversion Therapy. And I am grateful to begin with a land acknowledgement. I invite you all to join with me in the chat and acknowledge the correct Indigenous name for where you are located. If you're not familiar, you can go to placenames.napdev and .ca, which helps you zero in on where you are. So for example, instead of saying Halifax, you would say Kijapuktuk. And to me, this is sort of like live naming, like, you know, how like if you use someone's dead name, it's harmful. Live naming is a way of bringing healing. So I invite you to join with me in this act of trying to bring healing to where we are located. I'd like to begin by acknowledging that I am speaking from Unama'ki, which is located on the ancestral and unceded territory of the Mi'kmaq, whose inherent rights were recognized in the peace and friendship treaties that were signed with the Mi'kmaq, Maliseet, and Passamaquoddy peoples from 1725 to 1779. This series of treaties did not surrender Indigenous land, resources, or sovereignty to the British Empire, but instead established rules for an ongoing relationship between nations. The treaties were later reaffirmed by Canada in Section 35 of the Constitution Act in 1982, and they remain active to this day. So let us take this time to pause in reflection and gratitude for the land where we live and work. I invite you to really take this moment to pause in gratitude for where you are and perhaps to really feel connected to the land where you are. Maybe it's your garden, maybe it's a beach, maybe it's a hiking trail or a park, but to take this moment for gratitude. And we take this moment also to acknowledge the 94 calls to action of the Truth and Reconciliation Commission of Canada, and those that are specific to the field of social work that we want to really be thinking about as we do the work of educating ourselves, of both learning and also unlearning, and working to reconcile in the ways in which we practice and live and show up in this world. The Nova Scotia College of Social Workers commits to translating our acknowledgement into action by seeking to implement the recommendations of the Truth and Reconciliation Commission's calls to action, especially those regarding education. We commit to doing what we can to becoming better treaty partners. We commit to learning and to unlearning. We are all treaty people, so how does this impact what we do and how we do it? And how will it guide our work together today? The 2024 Canadian Association of Social Workers Code of Ethics has invited us to shift from the illusion of neutrality to actively becoming anti-racist and fighting against racism and all intersectional prejudice that is part of colonization. So decolonizing and truth and reconciliation are embedded within our code of ethics and is very central to everything that we are doing. We are in the process of reconfiguring what it means to be social workers, especially given the role that social work itself has played in supporting, perpetuating, and even advocating for and being instruments of colonial harm, recognizing that all forms of colonial violence are interconnected. And so our new code of ethics and everything that we are doing, our new strategic plan at the Nova Scotia College of Social Workers is all committed to working towards this larger healing journey. And this has many ramifications, but gender and sexuality is part of the ways in which colonization has caused harm, which I will explore in a little bit. But part of today's lecture is part of the Canadian Association of Social Workers' commitment to working to bring healing and reverse the damage caused by conversion, quote unquote, therapy. And this is not unique to the field of social work. So our statement, which you can find on the Canadian Association of Social Workers website, was originally written and released by the Canadian Psychological Association as well, recognizing the ways in which conversion, quote unquote, therapy or any therapeutic, quote unquote, therapeutic attempt to change the sexual orientation or gender identity of individuals causes harm. And so when Bill C-8, which ultimately wound up being passed a little over 2 years ago, was passed on, the Canadian Association of Social Workers advocated for it and made this statement and has been continuing to advocate for a Canada that would be free from conversion, quote unquote, therapy and its practices as part of our larger commitment. We at the Nova Scotia College of Social Workers are also equally committed to doing this. Over a year ago, we sent an open letter to Minister Druhan from the Department of Education and Early Childhood Development, and we CC'd also Minister of Health and Mental Health and Community Services that we want to work for a world where there is no conversionary factors, and I'll explain a little more about that, but the updates to the guidelines for how to protect kids from harm and keep them safe in school is part of our larger commitment. We are not alone in advocating for that, but we join together with the Nova Scotia College of Family Physicians, occupational therapists, healthcare providers more broadly, Doctors Nova Scotia, the Healthy Populations Institute, Canadian Mental Health Association. There are many more, and you can see the full letter on our website. We understand that decolonizing ourselves and our practice means recognizing the ways in which we are each impacted by the colonial system in which we all participate and from which those of us of settler descent continue to benefit. Each of us, depending on our social location or intersectional positionality, are uniquely impacted or oppressed. For example, those of us from African descent were dispossessed and uprooted from their land and brought to Turtle Island against their will as part of the white supremacy and slave trade that fueled the settlement of this continent. So we take this moment to reflect upon the unique impact of colonization upon each of us and upon our practice. It is within this context that this Lunch and Learn is being presented, how to heal from conversion, quote unquote, therapy. And what I hope to do today is to go over an overview of what is conversion and what is the connection between conversion and colonization. And then what does conversion, quote unquote, therapy mean or look like? And then what does healing look like? And really understanding is part of the healing process. And so I will be dedicating some time to these definition components before focusing the primary part of this lecture on healing from conversion therapy, both from a macro or systemic healing perspective, but also from a micro or clinical or therapeutic perspective. And what does it mean to come out as one's true self? And what is the healing power of euphoria, of joy and pride? And how does peer support play into that larger healing component? But first, let's look at what conversion actually means. So one definition is the act of turning or changing from one state or condition to another, or the act of being changed, transmutation or change. So we convert when we believe that who we are is not who we are supposed to be. So the question is, where do we learn this and who benefits from this? So conversion has been a tactic of colonization for centuries. Religion has been weaponized. So from the Crusades that have been happening for the longest time to the ways in which colonization showed up here on this continent of Turtle Island, religion has been weaponized, and the tactic of trying to convert people is part of the larger strategy. Colonization affects each of us differently depending upon our identity. So those of us at the margins have had our identities erased, or we have been oppressed, or told who we are is not as good as those who are at the center of the wheel of power and privilege. Gender and sexuality are both ways that colonial violence has been waged. Racism and ableism and other intersectional injustices are also tools of colonization that maintain the status and power of some of us as being more worthy or desirable than others. So this is an important construct to understand before we go into the deeper components. Colonization teaches us to blame and pits us against each other intersectionally. But we all inherited this colonial system that causes intergenerational trauma. And that intergenerational trauma is passed down through the generations. So the wars and the crusades and all of the different intersectional harms of colonization looks different for each of us. And we have symptoms that we call mental health that are really suffering related to this larger systemic phenomenon. Intersectionality is a description that was first coined as a term by the African American feminist Kimberly Crenshaw. And it's a lens through which we can see where power comes and collides and intersects and recognizes that race, for example, plus gender identity, plus sexuality can amplify the impact. So whereas one has a negative impact, multiple different intersecting forms of bias and colonial harm have an amplifying effect. And it's important to recognize that one way of thinking about colonization is to understand the ways in which it lives in our brain, the ways in which those of us who have been oppressed or harmed sometimes start to have a phenomenon called lateral violence, where we turn on each other as if they're competing for crumbs from the people who have all the power is going to somehow heal us. The ways in which we internalize that blame, the ways in which that colonial intergenerational trauma continues to haunt us and impact us. So Dr. Michael Yellowbird, who is the head of social work over in the University of Manitoba, talks about neurodecolonization, that first decolonization has to begin in our minds. And that is especially important when we're talking about something like conversion therapy, because that happens in our minds as well, and they are related. So he talks about how neurodecolonization involves decolonizing the mind and the body, recognizing that colonialism has an effect on trauma, the brain structure, the gene expression, the immune system, even our gut biome. And so this journey of decolonizing ourselves is really a journey. And it begins around dismantling racism and other forms of intersectional bias and recognizing that it's a journey. So many of us might know people, or maybe ourselves are in a place of denial that it doesn't exist. That's where the unconscious lives, where we are afraid and we don't want to really recognize maybe our own role in perpetuating or maintaining the larger system. And different forms of colonial bias will influence us and inform whether or not we're scared, whether or not we can be courageous enough to acknowledge our role and begin to acknowledge the larger systemic problem and our ability to begin to speak out, which sometimes involves risk and can be scary because we live in a world that is not yet inclusive of everyone. And that is where trauma really comes in. So trauma really comes in the ways in which we've got all of that deep intergenerational component. Many of us have experienced multiple forms of trauma, which is both an event or a situation, the meaning that we ascribe to it, the larger context within which it happens, both externally as well as internally, and then the ways in which we might experience it as inescapable. And Dr. Gabor Mate, for example, talks a lot about how freeze, which is one component of trauma, happens when we don't feel like we can escape something and we can't fight back. And so that's really where trauma begins to like take a deep, deep hold inside of us and inside of our brain. Trauma can change our brain. It changes the ways in which we have neural connections between our thoughts and brains and the parts of us that will affect our bodies. It has epigenetic effects intergenerationally. And this is why, wow, like my brain isn't working the way I want it to because the neural pathways are impacted. And so we have to recognize that there is a biological component, that the trauma will change the size of parts of our brain. It will affect what hormones are secreted. So when we say it's all in your head, like it's true, but it has deep components. We can't just will ourselves out of trauma. We can't just think positive. Trauma is something that impacts us and haunts us. And it has more than a fight or flight response. So freezing, fawning, flopping, the ways in which we might somehow start to identify with our oppressor as a way of coping is something that has been studied significantly. Um, and there are other responses, but the fact is that sometimes this happens at an unconscious level. So we may not even realize how we are impacted. And when we start to identify with the oppressor, we begin to lose our own sense of self. And it's something that usually happens very early. And it has other physical symptoms to it, but there are alternatives. And so recognizing the mind-body connection and recognizing the ways in which our body and our brains react to trauma is very, very important to recognize. And dissociation is something that is especially for people who've had significant trauma around their identity that can really impact them at a deep level. Identity tends to be formed very, very early. And so a lot of these trauma responses also are hardwired in us from early childhood traumas that happen sometimes even within through the birthing process. So, for example, I wound up being in an emergency, like in an ICU for the first week of my life. So the experience of being in an ICU impacted me in a permanent way. And that's one example amongst many in which the hardwiring happens early. It happens often before we're even born because of intergenerational trauma, the ways in which there is both behavioral and cultural components, but there's also changes to the DNA. So sometimes in utero, if the mother is stressed, then that stress hormone disrupts the endocrine system, which affects the way the baby's brain develops and the hormones are impacted. So when we're thinking about this, we have to recognize the larger whole of the ways in which colonization and intergenerational trauma are related. Colonization and religion, as I mentioned earlier, are also related. So the doctrine of discovery, for example, is what is encoded in both the American Constitution as well as within the Canadian legal system to justify the existence of these countries, where specifically it says with the doctrine of discovery that anyone who doesn't believe in Jesus is not a full person and their objects, their possessions can be taken, and that was part of the justification. And the colonial, conversionary, missionary, evangelizing, we're going to convert you to our religion methodology is one methodology amongst many that informs a lot of the way our current social society and social structures are formed. This also, of course, affects gender. And so two-spirit individuals walked here well before colonization existed. Gender existed before. Before the patriarchy, there were matriarchal societies. There was an honoring of the collective, of the ways in which the earth was part of us. We can see across the planet that there's multiple different approaches to gender. So, for example, if what is the pronouns in Mi'kmaq, Negum, for example, is means they, and it means he, it means she. It's the same word. There's multiple different ways of thinking about gender. So, for example, 2,000 years ago in the Talmud, Jews talked about 8 genders, right? So the notion of a binary two gender there's only male and female, that's it, is a colonial social construct that is reinforced by one specific religious approach, but not all spiritual or religious traditions and not all cultures. Adverse religious experiences, therefore, are part of the conversionary framework that we need to understand, the ways in which we are told that there's only one way to be and that anything else is a sin, is wrong. And other forms of religious trauma can sometimes coexist. They're not the same, but religious trauma, for example, can, for if there was sexual abuse, if there were other traumatic beliefs that were imparted, like who you are is not good enough, this can contribute to some symptoms that can become clinically observed as, for example, anxiety or depression, but they have as their root this larger structure. Religious trauma is a form of trauma. If you're not familiar with the Religious Trauma Institute, I invite you to check it out. So this is part of the larger context before I start talking more specifically about conversion, quote unquote, therapy, because there's this triangle and we can see how the therapy and the practices are part of this larger system. And it can happen in many different places. So we talked a little bit about religious communities, but it can happen in many other places. And ultimately, it winds up internally in the ways in which we absorb, like sponges, these messages and start to try to change oneself as a survival and adaptive mechanism, except that it's not particularly adaptive because it can cause us to hate ourselves and it can cause us more suffering. So survival is very different than thriving. So what is conversion therapy according to the law, which is now, it's illegal in Canada. It is not necessarily legal around the world, but luckily we live here where there is at least the beginnings of an awareness around this. So as of 2.5 years ago, it was made illegal to try to change a person's sexual orientation to heterosexual, to try to change a person's gender identity to cisgender. Cisgender just means that the gender you were assigned at birth matches with the way you identify. Some people do, not everyone. It also changes to how we express ourselves. So, for example, at one point in my life, I was in a context where I was told that I had to eat because I was assigned female at birth, even though I knew as early as the age of 2 that that was not who I was. I then was sent to girls' school, for example, and I was told to wear a dress. And then I actually went to a school which told me that I had to wear nylons and a skirt in order to have a job. There were uniform requirements based upon the assigned gender. That is one example of conversion therapeutic practice, trying to change a person's gender expression so it conforms to the sex that is assigned to the person at birth. It's not just in terms of gender identity, but it's also in terms of sexual identity. Those are two different concepts, but they are sometimes related. The efforts to repress or reduce one's identity or expression. So understanding what this is the first step to stopping and healing. Most people, when they think of medical conversion when they think of conversion therapy, they don't think of the religious component. They tend to think of the medical component. So usually, and certainly for me at first, I was taught about it, and it was like aversion therapy, like electric shock. Like if I, see a person of a different identity, or like I'm attracted to this person, that I would get like electric shocks to help me to stop having those thoughts and feelings. Because that never happened to me specifically, I did not understand the ways in which actually it's much broader. So we can't heal what we don't understand. And understanding is the start of healing. And especially as clinicians, assessment is always the first step towards clinical intervention or healing. Healing from conversion, quote unquote, therapy requires understanding how it has impacted us and how it continues to impact us. And it involves healing our relationship with ourselves. And now there's a growing group of people who have experienced it themselves, like myself, and who are also trained doing research or education or awareness on how can we begin to heal it. Being first voice led, those with lived experience leading this work is very important so that there is less of that bias of just like, for example, as a person who is white, I cannot be going to tell people who are Black how they should be healing from their intergenerational trauma. We have to be first voice led, and that's part of how we heal from a system where Euro-Western white Christian ideals were imposed upon everyone that didn't fit, everyone that was part of that intersectional wheel. Also really important for us to understand that sexual orientation is different from gender identity, is different from gender expression, and who we are sexually or physically attracted to and who we are emotionally attracted to, that this is very different. And so you may be familiar with the gender unicorn. When we're defining our terms, we want to recognize that there's actually more of a continuum and that each of us will fall on different levels of it, and we will assign different meanings based upon where we fall. But what's really important to recognize is that there's much more than the binary, and that that continuum is part of what needs to be recognized. This is especially true because intersex people exist. They constitute, research says, and I think that there's probably more to recognize around the research, but 1.7% of the population, that it's about as common as having red hair. So we need to recognize that just because something is less common does not mean that it is not real. So we normally think, oh, there's male and XY chromosomes and female XX chromosomes. But actually, there's a lot more than that. There's so many different variations, and our chromosomes interact with each other and impact our hormones in ways that are far more complicated than the gender binary. And each person is different. So forcing someone to be something they are not will not work. We can't pray away our chromosomes. Surgery and medical treatment should align with a person's identity rather than the identity aligning with a body part. So non-consensual surgeries on intersex babies is another form of conversion, quote unquote, therapy. I was in Indiana. A lot of my personal conversion therapy experiences happened in south of the colonial border in the United States, in Kentucky and Indiana in particular, which were not particularly queer-friendly places to live. And it was, about 20 something years ago. But when I was there, I recall hearing an obstetrician who talked about how, and started to cry. He was at IU Medical School, Indiana University Medical School, and he started to cry when he talked about how he didn't understand that what he was trained to do in medical school caused harm. And he was crying because he was like, there's so many children that me and my colleagues, we just made an assumption. We just were like, oh, this is like 1 inch longer here, so we're going to assign this person male and we're going to just do this surgery for them. We're not even going to tell the parents about it. We're going to just do the surgery. But it is possible to sometimes find some of those surgical records. So for example, Quebec has some provinces were more prone to doing this than others. And so recognizing the ways in which an arbitrary decision by a medical professional on what a person's body should look like and the non-consensual surgeries that happened and the ways in which this was done without an understanding of chromosomes, without an understanding of gender identity, and then children who are then medically altered, surgically altered without their knowledge, often without even their parents' knowledge, are haunted by the feeling of being in the wrong body for the rest of their life, because identity starts in one's brain and identity. And there are differences between the ways in which our brains are wired, the amount of gray matter and white matter, and the ways in which testosterone and estrogen affects each. And I'm not going to give a whole lecture on this, But for example, when one of the medical experiences that I went through personally is I was given at different times because my hormones were not what in Kentucky I was told was the appropriate type of hormone. So I was given at different times. I was given estrogen, I was given progesterone, I was given androgen removing pills because I had naturally occurring testosterone in my body, but I was given pills to remove that naturally occurring testosterone. And those affected my mood. They affected my capacity to concentrate. They affected my attention span. They affected my memory. They affected my motivation. These hormones affected the way my brain worked. It affected also my body. I have like permanent harm as a result of the ways in which my body reacted to hormones that shouldn't have been in there. I have, for example, fibroids that are permanent and can not be removed easily because they grew inappropriately because those hormones shouldn't have been inside of my body. But I didn't understand, the system didn't understand. And we see now the ways in which sometimes, for example, there might be some doctors who are working with a patient who is assigned female at birth and is wanting to stop their menses. And maybe, for example, they're being given progesterone because it's seen as less risky than Lupron, which, for example, is a way of stopping the hormones to let a child be able to make a decision for themselves. It does come with some risk in terms of if you long-term use could affect bone density, for example. However, giving a child progesterone, which doesn't affect the bone density, could affect their mood, could affect their suicidal ideation, could affect a lot of other factors as well. So we need to have a better understanding of risk, a better understanding of how hormones are part of the larger whole, and thinking about how that affects our brain chemistry. There isn't a lot of understanding about the ways in which our bodies, and we're still in the early stages of this, but what we do know is that there's many different types, and it's important for the person to be in charge of their own bodies and to be the one assessing based on mood how their feelings are. Religion is another way in which there can be conversionary practices. And we know that there's conversionary practices that exist across the planet, not just in some places, but also in others. There's some documentaries that are showing away some of that. And we've highlighted, for example, somebody who themselves was in the closet who was perpetuating some of this and how they woke up. That was our First Voice YouTube video, which you can go to our channel and learn more about. So what is called conversion, quote unquote, therapy? It's a much broader component. So the quote unquote therapeutic interventions, whether it's medical or religious, is part of a larger whole of the ways in which there's a systemic influence that can affect us. There's a pyramid, and these change efforts are complicated. They're not neatly separated, and heterosexism and cissexism enable this. And we are just beginning to understand how pervasive the influences are that perpetuate this. I am sharing with you right now some screens from the CBRC. I will share a few more, but there is research and awareness and resources that are starting to be developed. What we do need to understand is that it is far more pervasive than we understood. So most people who identify as queer have experienced, according to research, some form of conversion, quote unquote, therapy in religious communities and or therapeutic communities. And often this starts early. But once we see it, we can't unsee it. Maybe this is why there's so many efforts to try to ban education around it. Because once the unconscious is conscious, it ceases to have power over us. Once we understand, we can stop blaming ourselves and we can start to heal. So the Legal Information Society of Nova Scotia, for example, came out with a wonderful resource on called Let Me Be Me, which is a guide on Canada's conversion quote unquote therapy ban. The Community-Based Research Center has also put together a bunch of resources about this. So I invite you, if you are interested in learning more, to check those out. Here are a few more of those resources. So there's a support group that exists. There's supports for survivors, families, there's research reports, and there's advocacy around it. This is also from stopconversionpractices.ca, which is another website that tries to pull together all of the different resources so that there can be like a one place to go. And now there's work. I'm part of a national coalition where we are working with the Canadian Mental Health Association, with EGAL, Fondation Emergence, with Momentum, with multiple different researchers and practitioners and survivors, and we're all coming together to begin to figure out how can we stop this? How can we heal from this? There's still a tremendous amount of prevalence that many people have experienced it. We're still just doing the research on all of the statistics, but if you go to that website, you can see where it is. We can also see some first voice testimonials about what it was like. Primarily, they tend to be experienced either in religious context or healthcare-based contexts. And identifying what it is really important. It does not include, for example, a treatment or practice or service that explores or develops a person's integrated personal identity, such as helping someone with their transition. It's not casual impromptu conversations. It has to be a formal intervention, and it has to be specific to try to force someone to become something that they are not, whether it's overt or covert. Conversion practices are damaging because they attack the core part of a person's ability to define themselves, to trust, make decisions, and cope. It is part of what the United Nations and others have called a form of torture. So how can we begin to heal? So if you know somebody who has survived this, the first is to listen, believe them, validate their emotions, assure them that it's not their fault, and then trying not to fix into a fix it or savior mode. There are other resources as well. We're looking at the clinical components of it. I am going to be sharing some of this, and hopefully this video is going to be on this website soon. We are still just beginning to develop and research and test it. How can we begin to heal? First, it means looking at the different places it happens, recognizing it, and then figuring out different interventions for each of these different components. Now, as social workers, as clinicians, we have an ecological and systems approach. We understand that the individual is part of a microsystem, which is part of a larger set of systems, whether it is individual or communal or collective, organizational, and then we think of the larger social, political factors that are part of the influences that affect us. And we need to understand all the different factors. For example, adverse religious trauma requires specialized spiritual healing. We need more than a biomedical approach where the clinician is the expert. Rather, the person is the expert in their own experience. And then we look at multiple different biopsychosocial, structural, spiritual factors that can all collaborate together to create healing contexts where people can heal. We have to recognize the ways in which religion and politics is part of a larger awakening that collectively as a society we are only beginning to understand. But for many of us, our nervous systems are chronically activated. We turn on the news, especially in the last couple of years where there's been an increase in hate that is being spoken on the news, sometimes by politicians. And we see the ways in which that is causing more harm and more self-harming behaviors and beliefs. There is this vicious cycle. And so being exposed to discrimination and stigma and prejudice will cause more psychological harm. We know that queer people have a higher chance of being assaulted, and that there has been a rise in hate crimes specifically over the last few years. And queer phobia and violence continues towards the forces that can pressure people to feel like they need to hide or to become susceptible to conversion practices and try to change. So recognizing the ways in which all of these stories can cause people to feel like the world isn't safe for me as I really am, so I need to hide my true self. That is step number one, understanding that factor, working to address the larger structural factors, working to address all of the violence that is experienced, that affect people's ability to access healthcare, that affects people's ability to live as their true self. And each time the research shows that as soon as somebody is able to come out as authentically themselves, they are able to have a reduction in a lot of their suffering and symptoms. And it affects multiple different factors. So for example, people who are gender divergent or people who are queer identified are more likely to experience other systemic intersecting injustices that can cause them to have socioeconomic issues. Kids in particular will often be disowned or feel unsafe at home or are assaulted, and so they are forced out in the streets. And so we see the ways in which this becomes a vicious cycle, which is amplified by racism and other intersecting minority experiences. And it also causes a lot of people to enter into relationships that can sometimes cause harm, but it's often because we've experienced harm by other people more broadly. So for example, when I was crossing the border, I lived in the United States, I was coming back to Canada. When I was crossing the border, the immigration officers at the US border felt like my presentation did not match my paperwork. This was about 25, 30 years ago. And so they engaged in a very invasive and violent assessment of what my gender was. But because I did not have paperwork or documentation, I was going to school there, so I needed to be there. I wasn't able to speak out for myself. So people who, for example, because of their immigration status, are not able to advocate for themselves, are especially at risk for violence. Those experiences of violence then predispose people or amplify the trauma that can happen. When marginalized folks are used as political weapons and human rights are considered debatable, systemic and historic prejudice can become lethal. And so recognizing the intersectionality of all forms of violence is super important as part of beginning to heal. And recognizing the ways in which colonization around gender and faith have unique influences is another important part of our healing. Just recognizing that. So the Queer Interfaith Coalition, for example, is one cross-Canada group of queer-affirming, queer-identified faith leaders and communities that are working to create a new approach to faith, to reclaim the voice of religion that has been weaponized. That's one example of a larger structural effort to bring healing and safety. But it's part of a larger decolonizing commitment to decolonize gender and sexuality, to align with the land-based values. So, for example, pronouns in the Mi'kmaq language, negum, is used for all people. And it reflects that larger interconnected value of Nisit Nogma, where all my relations, this understanding that we are all one. Once we can see that, we can reconnect to a world where once upon a time, two-spirit people were revered in indigenous societies, as opposed to the ways in which they're stigmatized in the colonial world that we live in. So political action is part of how we might heal or fix the broken system that is part of that. So the Nova Scotia Legal Information Society partnered with us, the Nova Scotia College of Social Workers, to create a guide to reach out to your MLA, to reach out to your political leaders, to use your voice for change. That is healing. For people who've been silenced, to simply be beginning to advocate and speak out is one form of healing. But there's internalized homophobia, there's internalized transphobia, there's internalized queer phobia, and the fear of being disowned, the fear of being treated differently, the fear is something that is real and that requires some clinical interventions, which will be where I now focus. It's important to understand that trauma causes us to disconnect from ourselves. It affects our brains. Not being allowed to exist is a form of trauma. And we need to understand the ways in which trauma manifests inside of us. Ultimately, the question is of who am I, right? So for someone who, for example, I knew at the age of 2, I was starting to write letters to God saying, please don't let me grow up to be female. I knew very early on, and I found out in school when the teacher said, line up all the boys on one side and all the girls on the other, and I was in the wrong lane, and my teacher was like, oh, honey, you're in the wrong lane. That was the beginning of, oh, who I think I am is not who I'm supposed to be. So that then creates the larger foundation for other symptoms of if I can't trust myself and who I know I am, then that's the beginning of the disconnect from mind and body. There are many different types of therapy for trauma. Fundamentally, we can look at healing from the body, healing from the mind, healing from the spirit. Some of it is going to involve people making their own decisions, but for example, somatic healing is one form of healing. Other forms, EMDR to deal with trauma is another form. I want to recognize there are many, many different types of healing approaches, and it's important to be thinking about how we can begin to study it. But the root cause is the things that we learn early. I don't fit in. I don't exist. I am bad. I am a sin. I need to be fixed. I should not believe my inner sense of knowing. That is the larger consequence of the structural factors that currently exist in a binary world. And we are often very symptom focused, where we're like, we're going to fix the symptom. Don't have that quote unquote maladaptive thought. Well, that maladaptive thought was created because it was trying to adapt to a world where we were told that we don't fit in and we don't exist. And so the methodology of change your thoughts is not helpful. It's also not helpful that a lot of people who are gender diverse might also be neurodiverse. So being told that you have cognitive distortions might cause people to feel worse about themselves. So trying to fight our thoughts only puts us at war with ourselves. When we are taught early not to trust our inner voice, then being at war with ourselves can make things harder. And then being told, oh, you're not trying hard enough and no one believes me, then we start to not believe ourselves. And that's where we can become overwhelmed, feel buried under the weight, and that's where deeper psychological harm can happen. And it doesn't just happen in the mind, doesn't just happen in the psyche, but it can happen in the body. So Peter Levine talks about how the body keeps the score, the ways in which the body, especially when, for example, we might have experienced physical trauma and we are told that our body is who we are, but we know inside of ourselves that our body is not matched up with who we are. That's when we start to dissociate, we start to separate from our bodies, and that makes it much harder to heal. And that's where gender affirming care is so important, because it helps us live inside of our bodies and helps us find ways to make peace with ourselves. Feeling like one is in the wrong body, being forced to go through the wrong puberty, those are things that can have lasting and enduring harm. Believing that we can't trust ourselves, that no one believes us, can cause us to make very difficult and bad decisions. It causes shame and fear and distress and teaches us to hide. Really important to recognize the difference between gender dysphoria and body dysmorphia. If we don't understand that as clinicians, we might unintentionally cause harm and do a form of conversion, quote unquote, therapy. Learn to love your body is not something that works when it's about gender identity. One is about identity, one is about your body. Is your body big or small? Is different than what is your identity. And it's really, really important to recognize this because oftentimes when someone does have gender dysphoria, they will try to cope with the ways in which people often try to dissociate or numb their feelings, which may involve eating or drinking, which may cause body dysmorphia. So they may co-occur, but they are different. And it's really important to understand clinically the difference. Repressing one's true self can lead to suffering. It can lead to, I don't understand who I am. I don't understand why I'm making the decisions I'm making. And that causes us to not trust ourselves. That is the root cause that needs to be healed for conversion, quote unquote, therapy healing, is learning to trust ourselves. So recognizing there may be cognitive distortions, but we don't attack the symptom. We have to look at the deeper root causes. And that's part of decolonizing therapy. That is part of what we are also advocating for in our repositioning report. The medical model teaches us to focus on what is wrong to try to fix it. A strength-based model focuses on what is healthy and life-giving so we can heal. And we need to understand where the unhealthy beliefs come from and what we need to do to heal. Shame corrodes the part of us that believes we are capable of change, says social worker Brene Brown. And we can't shame or belittle people into changing who we are. So our coping behaviors, so for example, the overeating, for example, that is a coping behavior. That does not mean that everyone who eats is coping in a bad way, because there are many ways of doing that. But what I'm saying is we need to look not at the behaviors, but at the feeling of shame. The shame is the issue, not the eating. The trauma is the issue, not the behaviors that are meant to help people cope. Once we understand why we do what we do, that's when we can begin to heal and move forward. So one therapeutic modality that I think is really important as clinicians for us to be aware of and thinking about specifically with this patient population, and it's something that people can do also for themselves. Richard Schwartz developed internal family systems, and he wrote this book, No Bad Parts. It involves understanding that our beliefs were created for a reason, that we have coping strategies that existed to keep us safe in the past. But now that the past is over, now that we understand, now that we are adult, we can begin to heal. So instead of blaming, the first step is becoming curious. Why do I have these beliefs? Where did they come from? And are they true or accurate? Richard Schwartz talks about internal family systems. It's like starting with a civil war and helping it change into an orchestra or choir. Each of our parts have value and have something to keep us safer, but we have to find ways of working with those parts. We have exiles, for example, our inner children, the younger parts of us. Before we get hurt, we are delightful, playful, creative, trusting. Children are born. Dr. Gabor Mate talks about how a baby at the age of 1 day is born feeling and reacting to the world and learns early which feelings are okay and which feelings are not okay to have. And we develop our inner kids, the different parts of us. If we are hurt or wounded, we develop a coping strategy to try to deal in that situation. And that's where some of those parts first are born. We all have inner critics. And that especially is true when we're talking about people who've experienced conversionary practices. So internal family systems is one methodology of healing that recognizes there's a core self, and then there's protector parts. They are managers or firefighters or exiles, is the way he describes it. So they're all there to try to protect the core self that we're told is not safe as who we are. And so we become caretakers, we become advocates, we become fighters, we learn to hide or numb, and those are the exiles. So our different coping strategies become almost like masks that we wear in a certain time. I learned that if I am a really good student, then I will be safe. So I develop a manager side of me that becomes a perfectionist so that I can try to stay safe and get approval. Or I become a fighter as a way of keeping safe by creating diversions. Maybe I become the class clown. So, or I start to withdraw because I don't feel safe. So these are protector parts. Understanding ourself is huge. Getting in touch with the core self instead of believing that our perfectionist protector self is what's real is the first step towards healing ourselves. A lot of burnout, and actually my doctoral research was on burnout, a lot of burnout happens when we begin to identify with our fake protector self instead of our true self. Understanding ourselves is the first step to trusting ourselves and liking ourselves, because then we are no longer strangers to ourselves. Authenticity is an important part of healing. It may be that people require some of the other traumatic therapies. There's brain spotting, there's EMDR, there are multiple different ways of dealing with trauma to understand why we react the way we do. And we know that there's actually brain hormonal changes as a result of the ways in which we learn to rewire our brains through trauma therapeutic interventions. At the core of any modality is the attachment need between the clinician and the service user. So attachment is a survival need. And in the same way as we might have had to adapt early to our environment in order to attach to whether it's the doctor or the teacher or the caregiver, whoever it is, we might have had to deny our true self to please or have a sense of attachment. As a child, one learns to feel safe in whatever ways we can. The therapeutic power of affirmation is for the person to be seen authentically as one's true self in a clinical interaction, feel safe and affirmed. And that is when we begin to realize that we can create new and affirming attachments where we are seen, safe, and loved. As soon as we experience the feeling of being seen, safe, and loved, that is the medicine that heals everything. That is what actually heals us. As soon as we can feel safe, we can begin to let go of the armor, the defense mechanisms, the parts, whatever the term of the clinical modality you prefer, we can begin to show up and be true to ourselves. I want to talk about Bruce Ecker, who has talked about memory reconsolidation, which I think is especially important to thinking about pride and euphoria. And it's actually been shown to make therapeutic interventions faster. So what Bruce Ecker did is he actually went through all of the different therapeutic interventions he could to look at patterns, which therapeutic interventions, regardless of modality, were more effective than others. And he found that each time it involved addressing beliefs or schemas that we developed early, but connecting them to the attachment, to the relationship, to the feeling of safety, so that we physically and somatically experience safety. So he talked about coherence therapy. Now that we make sense, oh, I developed this coping strategy for this reason in this context. Now I make sense. Now it's coherent. That's a way that we can then revisit our memories once we discover ourselves to deactivate an old trauma memory. So for example, oh, I used to have this thought or feeling, but I have only partial memories because I remember this, but I also remember this, and I remember them based on stories I told myself. Once I revisit the stories I told myself through narrative therapeutic interventions, and I think about it, oh, in this context, as me, as somebody who was afraid to be myself because of my identity, then I had to learn this method. Having an ability to finally be seen as ourselves and to revisit that is very healing. Now, especially for someone who's transitioning. So when, for example, I am finally seen as myself and someone uses he pronouns instead of she pronouns, that is profound because I can be in the exact same context. I might be even interacting with someone that might have traumatized me a while ago, but when they treat me in a way that feels more respectful, I can have an opportunity to revisit the same experience, but with a different set of feelings. That euphoria is about being finally seen as ourselves. Everyone's going to be different, and it's so important that people make assessments with their clinician over what is safe and what is not safe. But the therapeutic reconsolidation process is one way of helping to revisit those memories, but with a different feeling. Once we're actually comfortable with ourselves, once we're actually feeling safe and loved and in touch with our adult self, then those earlier memories no longer affect us. So gender euphoria is the feeling of joy that comes with being able to present and be experienced as one's affirmed of gender or identity. It's about authenticity, to be seen for who one has always known oneself to be. This is healing. And this experience is profound and it rewires the brain. That's what he's talking about with the memory reconsolidation. Many techniques make it hard or easy to do that. I'm not saying that that therapeutic modality is good for everyone, but I am saying that especially in the case of gender euphoria, it kind of happens naturally. When people are interacting with me after I've experienced gender affirming care as who I am, the healing and euphoria of that is profound and it actually does rewire the brain. The deepest human need is to be seen by other people and known and be safe. And so there's more research that's just starting to come out around gender euphoria. What is that? Gender dysphoria is the dissatisfaction of being in the wrong, being identified in the wrong way and not being seen. But dysphoria is depression, anxiety, stress. There's so many reasons a person could be dysphoric. But not everyone's going to have euphoria when they are greeted with a different gender pronoun, for example. But for somebody who identifies as gender diverse, if there is that sense of, I finally am being seen as me, that is the diagnostic criteria that allows us. So gender euphoria as opposed to dysphoria is a more effective diagnostic criteria, but it also is its own intervention because the more we just do things that bring us joy, the more we are in alignment with our true self, then that is actually what helps us to heal. And once we feel more comfortable within our bodies through gender affirming care, then we can begin some of the somatic experiencing, which we are just now starting to understand is a really important way of healing the trauma that can be residing in our bodies. Peter Levine talks about the body keeps the score and the ways in which the nervous system reacted during times of stress or trauma and how sometimes that can stay inside of us. And so he looked at the ways in which as animals, we are wired to be able to release, co-regulate, find ways of releasing that trauma, but society has taught us not to do that, but keeps us in a state of constant trauma, which then can maintain or contribute to other illnesses or other symptoms later. So somatic experiencing is a form of bottom-up processing, and that is another methodology that can help people begin to heal from trauma. It happens naturally with gender affirming care. Part of gender affirming care is the experience of euphoria, of pride, of authenticity. It is how we begin to heal ourselves, and it is how we can begin to connect with people who see us as ourselves. We cannot heal in a relationship where we are not seen for who we are. We cannot heal in a structure that is causing us harm. But every moment that we have a moment of being seen. Those little moments, it's like crumbs, but each little spark can grow bigger and bigger so that it becomes a bright, shining light that can heal us. And so that is part of that. You may have seen the 4 Blinks version of Flash. That is considered an adjunct therapy for EMDR and healing trauma, that it actually can be done, and we have a video on this that we've already talked about. It can be done simply by every time I have a moment of euphoria, I can blink. The brain has been wired according to this approach to recognizing that when it's almost like when you have the I'm blanking on the name now, but it's a way of rewiring. So it's like you can, by blinking, it's like creating a new passage, a new memory, so that it can reduce the experience of trauma. So when I'm being seen as myself, if I take a moment to breathe deep, enter into my somatic state, blinking, it actually can help rewire, and I can hardwire joy and euphoria where before there was trauma. It's a way of creating new associations. There's a lot more to it. It's an open version. So I invite you to take a look at 4 Blinks version of Flash. There's guides, there's research, there's trainings. It's open to everyone. And it's a very fast way of helping to heal. It should be used as part of a larger whole, but it is a methodology that can help with trauma reprocessing. It doesn't even involve revisiting old traumatic memories. Simply the experience of having joy in a context where we used to have trauma, that is enough to help rewire us. And the blinking can help cement that, to help hardwire it inside of us. Ultimately, healing involves learning to care, to love ourselves, to recognize ourselves in the mirror as who we are. And it is possible. I didn't think it was possible, but it is possible. And more we're collecting stories around queer joy and the ways in which healing is possible, but it comes through joy. It is possible to hear from conversion practices. It is possible to feel free and seen and safe and affirmed. There are only a few pockets. The world is not yet safe for all of us, but through the larger understanding of what these factors are, the more we can begin to heal. And so with that, oops, I was going to say, the field is still new. So check out stopconversionpractices.ca or cbrc.net if you are interested in more. Research is needed. This is still very new. It's only been 2 years in Canada that it has been illegal to have it, and that does not mean that it's not still happening. It just means that it has just begun to be something that we're aware of. So I thank you all for being here with us. And with that, I will take any questions that you might have. I appreciate all of your really kind reactions, and I hope that you all join me in working for a world where everyone can be safe, to be themselves, to be who they have always known they are, and we create a world where everyone is respected and has justice. And it's a healing journey, but I'm so grateful to have you all with us. Thank you.